My name is Husam Abdel Qadir. I'm a cardiologist and scientist, and I work at a Women's College Hospital and the University Health Network, mainly at the Toronto General Hospital site. My area of clinical and research focus is heart disease in people with cancer. My research program generally tries to focus on trying to reduce heart disease in people with cancer, but also to try and make sure that people who may have heart disease or are at risk for it don't lose out on getting the best cancer treatment possible because people are worried about their heart. So we've got to try and find that sort of sweet spot between making sure that we protect the heart while at the same time not being overly worried about the heart such that the cancer doesn't get treated as well. Cancer treatment is a scary time. People are scared about their cancer, and when they hear that treatments may weaken their heart, they get really scared about their heart health. For the vast majority of people, unless you already have a serious heart problem, your priority should be on trying to treat the cancer. A lot of times that is the better decision, and we can manage the risk of heart disease that comes with it as long as that's thought about ahead of time and we make plans to deal with it. A lot of my earlier research has focused on women with breast cancer because it is one of the more common cancers. But breast cancer is a type of cancer where, unfortunately, a lot of the treatments that are necessary to achieve a cure can weaken the heart in different ways. At the same time, it is a cancer that has very high cure rates. So it is what I perceive to be sort of the highest risk, highest reward situation. Thankfully, we found that for the vast majority of women that are treated for breast cancer, that heart disease, even if it does show up, it's not going to be severe enough that it ends up limiting the length of their life. Emphasizing, even though you may be worried about your heart, I can reassure them that it is most important for them to get the best breast cancer treatment possible. We've contributed to a body of literature that shows that for many women, even though we're really worried about the chemotherapy on its own, even if it weakens the heart, it doesn't weaken it enough that the person will go on to have problems from their heart that they can feel unless they have something else, unless they have troubles with blockages in the blood vessels of the heart, or unless they have high blood pressure or diabetes or something else. And this was really important because it has contributed to shifting our approach towards treating these women. So rather than spending so much time fussing about how the chemotherapy is going to hurt them, we now spend more time trying to think about, well, what is your blood pressure? What is your cholesterol like? Are you smoking? Are you physically active? And let's try and focus our attention on these things. We kind of tried to put it all together in a study where we actually developed a risk prediction model where we looked at women who've been treated in Ontario for the past 15 years. We identified every woman that was treated for breast cancer. We identified everyone that went on to develop a heart problem afterwards. We looked at what their health was like before they started treatment. And because, like I said, usually you need something on top of the breast cancer treatment to develop heart disease, we're able to put it all together to create a model where you can actually determine based on our calculator what a woman's age is, what elements of her past medical history are, and based on that we provide a prediction of what the risk of serious heart problems is over the next 5 years or 10 years. And in general that's helpful because most people are actually pleasantly surprised to kind of see that the risk is not as high as what they think it is, as long as they don't have other health issues. But then it also allows us, once we know what that risk is, we can decide how to treat them appropriately. So women whose risk is very low, perhaps can be followed through their family doctor and then can do less intensive things. Whereas women for whom the risk becomes a little bit higher, those would be the women for whom we may want to consider medications to control their blood pressure and cholesterol and so on and so forth. And then over the past few years, we've expanded our interest beyond breast cancer. And in particular, we've spent a lot of time trying to study some of the hematologic malignancies, like the blood cancers. And we've done a lot of work looking at the medications that are used to treat a type of leukemia called chronic lymphocytic leukemia, because there has been a generation of medications that has dramatically improved outcomes for those patients, but unfortunately they come with a risk of heart disease, including heart rhythm problems known as atrial fibrillation. If we take a step back then and look at the big picture, the key takeaways from the work that we've done, I can distill them to a few different points. One is that although many cancer treatments have a real risk of weakening the heart, for many people, unless they have a lot of heart problems or a lot of other health problems, the risk to their health that comes from weakening the heart is not so high that they need to avoid cancer treatment. Rather, for the vast majority of people who are going to undergo cancer treatment, rather than focusing on the risks to their heart that comes from chemotherapy, we need to spend more time trying to focus on the other things that are predisposed towards heart disease, in particular things that are relatively simple to treat, such as blood pressure, diabetes, cholesterol, physical inactivity, and weight gain. And that needs to be the focus of more of our discussion. Focus on your cancer treatment, but then try and incorporate low-hanging fruit that can simultaneously help with your heart health, but can also potentially help your journey through your cancer treatment become a little bit less difficult. And I think physical activity is a big part of that. We do have clear data that shows that people who find ways to stay physically active through their cancer treatment do better, not just from a heart disease perspective, but also from a cancer perspective and a mental health perspective. It is important to have discussions about what the long-term effects of cancer treatment are, not necessarily because that means that you should avoid the cancer treatment, but then that allows you to plan about what you can do to mitigate those risks. And a lot of times the plan to mitigate those risks starts during your cancer treatment and then becomes intensified after you finish and you're in a better position to take on a different challenge.